Hi folks, Dr. Wallace here. I had a person email me from the UK asking me a question about vitamin D and why she couldn't get her vitamin D levels to rise despite taking 5,000 IU vitamin D every day. And I wanted to address this because that is a good question, and vitamin D is something everybody should know about. Vitamin D is something everyone should have tested at least twice a year, in the spring and in the fall. And I see too much blood work coming to me from other places that does not include vitamin D. And it is very important. It's more of a pro-hormone than it is a vitamin anyway, so it's super important. We also deal with functional ranges where we want our vitamin D levels to be at least 50 or above, 50 to 80, 55 to 80 some say, not above 30 like the lab ranges oftentimes will show. So why would a person not be able to have their vitamin D levels rise? Well, there's a couple different reasons. First reason is, and I don't know anything about this person, anything about her history or what, but if a person didn't have a gallbladder, they would have up to 40% loss of their fat-soluble vitamins being absorbed. Vitamin A, D, E, and K. That's number one. The second reason, and the more likely reason that this is happening, is a polymorphism or a gene mutation that that many people have. A lot of my patients have this. We deal with a lot of people with hypothyroidism, the autoimmune hypothyroidism called Hashimoto's, and many of those patients have this VDR, or vitamin D receptor site polymorphism. Just means it's a little different shape, and we're not able to absorb the vitamin D as well as we normally could. We test for that in our office. We do a whole host of gene tests so we can determine what a person might be lacking and what they need support in genetically, because that's very, very important. So we would test for that and find out if that was the issue in her. So that's really important to do. So those are the two reasons why a person might have, just off the top of my head, why a person might not be absorbing vitamin D. There's also the possibility of taking a vitamin D supplement that is not a good one, or one that does not include what it says it includes. And there's been recent studies on on that, poor quality vitamins. So, because the most expensive vitamin you can buy is one that doesn't have anything but dust and fillers in it and not include the real stuff. So hope that's helpful to you. Get your vitamin D levels tested. Oh, and also, if that is the case, if you can't get your vitamin D levels to rise, we want to test two different levels of vitamin D. The 25-hydroxy, which is 2,5-OH vitamin D. We also want to test the 1,25 vitamin D. So the 1,25-hydroxy vitamin D in addition. So the stored form and the active form need to be tested if that's happening. So hope that helps. If you have questions, don't hesitate to call.